Hello, my name is Ethan Graber, and today I'll be talking to you about shigellosis, also known as dysentery. This presentation will give you a clear understanding of what it is, what it causes, who is at most risk, how it behaves in the body, and how it is treated. This disease, while often overlooked, can have serious consequences, especially for vulnerable populations. Let's dive in. Shigellosis is caused by a type of bacteria called Shigella. There are four main species of Shigella that cause illness. There's Shigella soni, which is the most common in the United States, Shigella flexneri, Shigella boydii, and Shigella dysenteriae, which is the most deadly. Each species can cause disease, but Shigella soni is the one that is encountered here in the U.S., and the bacteria is highly infectious. As few as 10 to 100 organisms can cause this illness. It spreads primarily through the fecal-oral route, which means that it is usually contracted through contaminated water, food, or contact with an infected person or surface. So what happens when someone gets infected? Shigellosis typically lasts about a week, with symptoms appearing 1 to 2 days after exposure. These symptoms include diarrhea that lasts longer than 3 days, often bloody or mucus-filled, fever, stomach cramps, a constant urge to pass stool even when the bowels are empty, a condition known as tenesmus. While it can affect anyone, certain groups are more at risk. These include children under the ages of 5 who may not have the best hygiene habits, travelers to areas with poor sanitation, gay, bisexual, and other men who have sex with men, people experiencing homelessness. These populations often face environments where close contact or limited access to hygiene makes infection more likely. Let's talk more about the characteristics of this disease. Shigella bacteria are very resilient. Once inside the body, they invade the lining of the intestines and cause inflammation. This inflammation is what leads to severe diarrhea and abdominal pain. Unlike some bacteria that stay in the gut, Shigella can actually enter the cells that line the intestinal wall. This leads to tissue damage, bleeding, and the signature symptom of bloody stools. It's not just uncomfortable, it can be dangerous, especially in young children or people with weakened immune systems. Due to the risk of dehydration and complications, another important point is how quickly it spreads, because only a small number of bacteria are needed for infection. Outbreaks are more common in settings like schools, daycare centers, nursing homes, and shelters, anywhere with close human contact. Now, how is it treated? For most people with mild shigellosis, rest and fluids are enough. The body usually clears the infection in about 5 to 7 days. However, more severe cases require antibiotics. The most common used antibiotics are ciprofloxacin and azithromycin, which are very common in any other bacterial infection. These help to shorten the duration of illness and reduce the spread of bacteria to others. However, antibiotic resistance is becoming a concern, especially with Shigella soni. This makes careful diagnosis and treatment essential. One critical note, people with shigellosis should avoid antidiarrheal medications like loperamide, Imodium, or diphenyloxate with atropine. These drugs slow down the gut, which can actually worsen symptoms by trapping the bacteria inside the body for longer and allowing the bacteria to grow. Instead, use bismuth sabiculate, the active ingredient in Pepto-Bismol. May help relieve the symptoms without interfering with the body's natural defenses. When we look at shigellosis in the body, it is clear to see how damaging this bacteria can be. The infection causes ulcers and inflammation in the colon. The immune system reacts by sending white blood cells to the site of infection. But this can, in fact, worsen the inflammation, leading to more discomfort and tissue damage. In severe cases, particularly with Shigella dysenteriae, there is a risk of complications like hemolytic uremic syndrome, a serious condition that can lead to kidney failure. Fortunately, this is rare in the US, but still a major concern globally, and it takes a lot of lives, but it is very rare to come across in the United States. For this presentation, I've relied on trusted sources, including the CDC, the Center for Disease Control and Prevention. If you'd like to read more about the disease, treatment options, or current outbreaks, I highly recommend visiting the Shigella treatment and the About Shigella page on the CDC website. To wrap this up, shigellosis is a serious bacterial infection that is easily spread but also highly preventable. Main ways of preventing shigellosis is practicing good hygiene, especially hand washing, which is the most effective way to stop its spread. Public awareness, proper treatment, and attention to vulnerable groups can reduce the impact of this disease significantly. There are also many other ways to prevent this disease, and it is not just a disease that you come across in the very famous game of Oregon Trail. And there has been many different cases throughout the United States, which has been very prominent. Thank you all for listening, and I hope you leave today with a better understanding of shigellosis and why it matters in both public and personal health. Thank you.